Hello, it's time for Chapter 11, the Respiratory System. I want to pronounce the words for you so you have had a chance to have heard these in real life. So, join me on page 373. First word, atelectasis. Weird word, shows up a lot. Imperfect dilatation of the lung, not a good thing. Partial collapsed lung, major. Shows up on x-rays. Patients are having trouble breathing. Next page, bronchiectasis, bronchiolitis, bronchitis, bronchoscope. You could be repeating after me. That would work out well for you. Cheyne-Stokes respiration. Let's not talk about it. Cough, croup, cyanosis. I skipped one on the bottom of 374. Carbon dioxide, also called CO2. On to 376. Cystic fibrosis. Diaphragmatocele. Notice that in that word, that G, which is usually silent, shows up. Diaphragmatocele. Dysphonia. Dyspnea. Dyspnea you're going to see a lot. Very common complaint. Difficulty breathing. Do we know what kind? Do we know what caused it? Not yet. But it's a great symptom for presenting. And people with dyspnea are usually scared because they think they're going to die, because they could. Emphysema. People with emphysema often have dyspnea. Empyema. Endotracheal, often called ET, especially if we're talking about a tube that is going to be placed endotracheally. We'll call it the ET tube. Epistaxis. Funny looking word, isn't it? It's a nosebleed, but you get a lot more. You could maybe call in, get a day off from work. I had epistaxis yesterday, and I'm not really sure. The doctor wants me to take another day. If you work in a healthcare office, this is not going to work because they will know what epistaxis is. Eupnea. That's a weird looking word, and if you hear eupnea and you didn't know that EU was U and it means good, you'd have a heck of a time finding it in a dictionary. Eupnea means good breathing. You're not breathing too fast, not breathing too slow, you're not having difficulty breathing. So does eupnea show up? Not that much. Who comes in the hospital and complains, I'm breathing well? Well, get him a bed. Admit him. No. Exhalation, breathing out. Expectoration, coughing up and spitting out whatever was in your lungs or your bronchi. Heimlich maneuver. This is a procedure that even small children can perform on somebody smaller than them. Who knew? We've seen things where 7-year-olds performed a Heimlich maneuver on a 4-year-old and had it work. One difficulty is, what if you're ready to perform a Heimlich maneuver and somebody is clearly having trouble breathing? First, establish they're having trouble breathing. If you are coughing, if they're coughing and coughing and coughing and coughing, do not ask them, are you all right? No, I'm not all right, but I'm busy. So they're coughing and coughing. If they're coughing, you can hear that. They're moving air, and so they're still oxygenated. Leave them alone. If they're holding their hands like this and not a sound, hark, then you have time for a Heimlich maneuver. So you get around behind them and you're ready to put your fist, your double fist, right underneath their breastbone and give it a shove upwards, trying to move their diaphragm so air will pop whatever is choking them out. I had occasion to do a Heimlich maneuver and I could not get my arms all the way around this lady. She was big. I locked these fingers and was able to do it. I tried 3 times before something came up, and I'll tell you what, I was ready to knock her to the ground and jump on her chest or her stomach, pushing up. And that indeed would have been the next step with a Heimlich maneuver. But fortunately, we didn't have to resort to that. Still gives me chills. Scared me to death. Hemoptysis. Hemoptysis, you coughed it up, you spit it out. And usually it means, well, very frequently, it means you have tuberculosis. One of the reasons it's against the law in Arizona to spit on the sidewalk. Arizona was a TB sanitarium. And in fact, Sunny Slope was a tent city filled with people with tuberculosis. And so you certainly didn't want to be walking barefoot and step in their hemoptysis, because if you had a tiny cut or you'd stepped on a sticker, you would have an entryway for the tuberculosis bacillus to get to your bloodstream. Tuberculosis can affect every tissue of your body. That seems weird. You can have tuberculosis of a bone or of the brain, as well as the lung or kidney or stomach or anything you have. Hyperpnea, breathing too fast. Hyperventilation. Hypoxia. Influenza. Inhalation. Opposite of exhalation. Breathe in, breathe out. Laryngeal. Larynx and pharynx are 2 of the most frequently mispronounced terms in medical parlance. And people transpose, so it sounds like larynx and pharynx. Ooh. I've even heard doctors and nurses, and heaven forbid, respiratory therapists mispronounce it. So laryngeal is pertaining to the larynx. Laryngitis. Notice how that X at the end of larynx turned into a G, and a soft G that sounds like a J besides. It's tricky that way. Laryngoscope. Well, great. We just learned G had a soft J sound, and now you're going to throw a G sound at us. Not my fault. It's just the way it is. Legionnaire's disease. Lobectomy. A lot of times you hear lobectomy or lobotomy, you think of the brain, but many organs have lobes, and lungs have lobes, and sometimes we can take out one lobe of a lung that is diseased and save you from having that disease rot inside your body and cause terrible things to happen. Mesothelioma. Commercial on TV used to call it mesothelioma. Drove me crazy. Mesothelioma. Nasopharyngitis. Olfaction. That's not a word you're going to see very often, although maybe olfactory, as your olfactory sense is diminished. Some people lose their sense of smell after, say, a tonsillectomy. Oropharynx. Orthopnea. That is a word you will see a lot. Orthopnea, inability to breathe unless sitting up or in a straight position. People with orthopnea, you can't lay them down on an x-ray table for 10 minutes to get a DEXA scan, because they'll become short of breath, and when you sit them up, they'll swoon, almost pass out. What do you call that? Syncope. Remember that one. Palatopharyngoplasty. Pertussis, which is for whooping cough. Pharyngitis. Pleurisy. Pleuritis. That one, inflammation of the pleura, the sac that your lung is in. It only hurts if you breathe in or breathe out. So people with pleurisy, you'll see their symptom is they're breathing like very short, very shallow. They don't want their chest to move. Pleurodynia, pneumoconiosis. That one was black lung disease, very common around coal mines. Pneumonia. Pneumonia is a pretty broad diagnosis. If we're having trouble treating your pneumonia or whatever we're using for treatment, you're not responding, then we'll have to culture it. And there's about a billion viruses and bacteria that could cause your pneumonia. And they may have a specific antibiotic or treatment plan that will work for them. So pneumonia, pretty broad, pretty general. Nevertheless, a good diagnosis. Pneumonitis, pneumothorax. Pneumothorax is air in the chest. If you have air in the chest, it should be inside your lung, not outside of your lung. So it's a collapsed lung. Polyp. You may have heard or remember we talked about polyps with the GI tract. Well, you can get a polyp just about any place you have a mucous membrane. And where do you have mucous membrane? Almost everywhere. So polyps inside the nose or in the throat, the vocal cords, anywhere. Inside the bronchi. Just trying to cheer you up. I don't think it worked. Pulmonectomy. You'll hear pneumonectomy more often than pulmonectomy, and it would both mean removal of lung. Pyothorax. RAL. I know it looks like a rail, but it isn't. It's a RAL, like it's spelled R-A-W-L. I can't believe they didn't show you how to... Moving right along. Respirator. Respiratory Distress Syndrome, often referred to as RDS. Respiratory Syncytial Virus Infection, RSV. Most winters or spring times you'll see a sign in a hospital that restricts visitors. We don't want visitors under 12 or over a certain age, because these are people that might be very sensitive to the respiratory syncytial virus. Notice, it's a virus. We can't just throw an antibiotic at it and expect the virus to be gone, because it won't work. So infants, small children, and the elderly are the ones who catch this, and it becomes life or death. Rhinoplasty. Rhinorrhea. Isn't that fancy? You can call up if you work at Circle K and say, I have rhinorrhea, I can't come in today. But if you work in a medical office, they're going to know it's a runny nose. And they're going to say, get in here. Rhinovirus. Bronchus. Sarcoidosis. Severe acute respiratory syndrome, or SARS. This one was a scary one. People were catching it on trans-oceanic flights, and you're in this weird tube hurtling through space, and people start to cough at the beginning of the trip, and by 8 hours later everybody's coughing. That's scary. Sinusitis. Spirometer. Sputum. Sputum is not the same as saliva. Saliva is a clear fluid. Sputum is mucus and comes from, weirdly enough, it's draining out of your sinuses. All of that stuff you have to cough up, it came from your sinuses. It drained down. If you have an upper respiratory infection and your sinuses and your nose are just driving you crazy, while you sleep, it's draining constantly. And half of it goes into your stomach, the other half goes into your lungs. And what goes into your lungs, the only way to get it out is to cough it back out. I don't want to sound like an advertisement, but I swear by Mucinex. Spirometer, just to measure breath.